Hi, I'm Dr. Deepthi Prasad. I'm a dermatologist practicing dermatology for the past 10 years. In addition to interest in core dermatology, I also have some inclination towards research and development of skin and hair related products both in cosmeceuticals and pharmaceuticals. So today I'm here to talk about a universal concern nowadays in this modern living both in men and women, that is hair fall. So why should hair fall be a problem? What is normal? What is abnormal? How to identify various causes of hair fall? At which stage we should consult a dermatologist? And what is the difference between hair fall in men and women? Various treatment options, procedural treatments, last but not the least, breaking the myths. Stay tuned. Next half an hour is going to be all about hair fall. So to understand about hair fall in detail, we need to have a basic idea about hair anatomy and physiology. So the most beautifying component of our looks is hair. But do you know that most of the hair is dead tissue? Yes, and the basic protein that forms the hair is called as keratin. So what we see outside is hair shaft. What is present in the scalp is hair follicle. The main part of the hair follicle is hair bulb, that is the lowermost part of the hair follicle, which is present deep in the dermis. And the upper part of the hair bulb is called as outer root sheath, that is hair bulge, which consists of stem cells that is important for new hair formation. The tip of the hair bulb is called as dermal papilla, which gives blood circulation to the hair follicle. And attached to it is a sebaceous gland which produces sebum. The whole unit is called as pilosebaceous unit. So the sebaceous gland produces sebum which comes out through the opening of the hair follicle and forms the oiliness of the scalp. Hair shaft consists of three parts. The outermost part is called as cuticle, which is very thin, colorless and made up of scaly cells. And the middle part is called as cortex, which is the part of the hair shaft which gives the strength, color and texture to the hair. The innermost part is called as medulla, which is not present in all types of hair but is present only in thick and terminal hair. So the smoothness is because the cuticles are, so the smoothness of the hair shaft is because of the closed cuticles, and it becomes harsh when the cuticles open up. So the outermost part is very crucial for the softness and the roughness of the hair. Coming to physiology, as any other tissue, hair is a continuously growing tissue. The hair growth cycle consists of three parts: anagen, catagen and telogen. Anagen is the longest phase which ranges around 3 years, and 80 to 85% of the hair are present in anagen phase. Catagen is a transition phase which lasts for 3 weeks, and telogen is a resting phase which lasts for 3 months. So when there is an imbalance between these three phases, when anagen phase decreases and telogen phase increases, there will be hair fall. So normally 50 to 100 hair fall per day is absolutely normal. And most of the times this number of hair which falls off goes unnoticed. When the hair fall is more than 50 to 100 per day, then there will be gradual thinning on the scalp which is called as hair loss. So hair fall can be normal. If the hair fall increases, that is visibly seen on the scalp as thinning of the hair, that is decrease in the density of the hair, which is called as hair loss. So this is a time where you have to worry. Definitely there is something going on in your body which is triggering the hair follicles, decreasing the anagen and increasing the telogen and subsequently decreasing the hair density. So this is hair loss. So now coming to various causes of hair loss. As we have learned earlier in the physiology of hair cycle, when the anagen phase decreases, when the growing hair decreases and telogen phase increases, that is the resting phase increases, then it is visibly seen as hair loss. So the first important cause, which is most common both in men and women all over the world, is androgenetic alopecia, which is also called as hormonal hair loss, also called as patterned hair loss. In males, it is called as male pattern baldness. In females, it is called as female pattern baldness. Around 70 to 80% of men sometime in their life suffer from androgenetic alopecia. Gradual recession of the frontal hairline, thinning of the hair and thinning of the vertex area. So these are the features of androgenetic alopecia. It has a genetic predisposition. Yes, there is a family history. Usually parents or uncles in the family, if they are positive with this kind of history, subsequently family members can be affected with this. Now at Hamilton scale, this is a classification to grade the severity of the male pattern baldness. Depending upon the severity, it is graded from grade 1 to grade 7. Coming to female pattern baldness. So here it is a little bit different. In females, the pattern baldness, the frontal line is more or less preserved, and there will be gradual thinning of the crown area. Once again, in female pattern baldness, there is a family history and genetic predisposition. So what happens in this kind of hair fall? So this is all because of a hormone called as testosterone. So the active part of testosterone is called as dihydrotestosterone. So this conversion of testosterone to dihydrotestosterone is done by an enzyme called as 5-alpha reductase. It is present in many tissues in the body, including the hair follicles. So this enzyme converts the testosterone to dihydrotestosterone, which acts on the follicles to miniaturize the hair follicles. In the sense, there will be gradual decrease in the size of the hair follicle, thinning of the hair shaft, and finally it reaches a stage where the hair follicle completely buries itself in the scalp. So that is the stage where there is a visible hair loss. And if you observe bald people, the skin is non-pinchable. In the sense, you cannot pinch the skin on the scalp. That is because of fibrosis. So that also happens in this kind of hair fall. There will be loss of subcutaneous tissue and fibrosis, which gradually presses the anagen phase and makes it inactive and finally goes into a resting dormant condition. And second most common cause, hair fall because of underlying endocrine abnormalities, most common being hypothyroidism and hyperthyroidism. So in these patients, there are few symptoms with which you can identify the thyroid disease. First being hair fall, and females, there will be abnormality in the bleeding, the periods, there will be bleeding abnormalities, and also weight gain. So that is a time where you have to get evaluated by an expert for your thyroid hormones. And second most common cause in females, especially during the menopause, because of hormonal imbalance, once again we tend to see hair fall. So identifying the cause, treat the cause, and give supportive therapy, yes, we can definitely address the hair fall. Third one is acute telogen effluvium. Acute is sudden, telogen is the telogen phase, effluvium is fall. So when there is increased telogen effluvium, secondary to important conditions of stress, say for example, post-pregnancy or post-fevers, post-accident, or any unexpected event in the family. So these kind of situations take the body. So in these kind of situations, the stress in the body decreases the anagen phase and increases the telogen phase. So there will be sudden hair loss. After few weeks post these events, which is diffuse in nature. So identify the actual cause, give symptomatic therapy, the hair fall will definitely be controlled. Next one is chronic telogen effluvium. In the sense, this process of hair fall will be very gradual. For example, post-pregnancy, hair fall is very much expected in females. But if this is not taken care of and underlying any nutritional deficiencies, for example, calorie deficit or protein deficit, vitamin D, vitamin B12, calcium, micronutrients, when these nutrients become deficient in the food over a period of time, there will be gradual hair fall leading to thinning on the scalp. So this is called as chronic telogen effluvium. So this condition needs proper blood investigations and identify what exactly is the reason for this hair fall, treat it and give supportive therapy. Definitely the hair fall can be controlled. Next one is alopecia areata. So this is autoimmune mediated hair fall. So what exactly happens here is, so in this condition, hair follicles are targeted. So the autoantibodies go and destroy the hair follicles and there will be hair fall. So how to identify this? There will be sudden hair fall. Within few days, there will be a bald patch on the scalp. So once again, it's a very stressful condition. People don't understand why they are losing so much of hair suddenly. So there could be some underlying autoimmunity going on. So investigations are very important to see if there is any associated other autoimmune disease, treat them promptly. And if required, some immunomodulants and oral medications should also be started in addition to topical therapies. Next is trichotillomania. So this is a psychiatric disorder where patients will be obsessive to pluck out their hair. So on dermatoscopy examination, we can see broken shafts. So that is classic of trichotillomania. Psychiatric evaluation and treatment is very important in addition to specific hair fall therapies. Next is diffuse alopecias secondary to some specific conditions like systemic lupus erythematosus, or secondary to specific medications, for example, anti-epileptics, also can lead to diffuse kind of hair fall. Next is anagen effluvium. So this is specifically seen in cancer patients who are on chemotherapy. So chemotherapeutic drugs, they target actively dividing cells in the body. So the hair follicles are also one actively dividing cells. So that is the reason anagen is targeted, and all the anagen hair fall off, leading to diffuse alopecia. Almost every hair on the body is lost. Once the chemotherapeutic drugs are stopped, after few months to years, people tend to get back their hair, and here is a role of a dermatologist where we need to start them on good supplements both orally as well as topically to help the hair follicles to give out new hair. Next one is harsh hair care products and hair styling procedures. So here we have to understand the concept of scalp pH balance. Just like our skin has a pH, our scalp as well as hair has a specific pH. So the normal pH of scalp is around 5.5 and the pH of hair is around 4.5 to 5. So here we also need to know the pH range of widely used hair care products. For example, take shampoos. So the pH is between 10 to 13 and a conditioner pH is around 3.5. Hair serum, it should be around 5. And all those straightening, smoothing, rebonding and all those chemicals, the pH is around 9 to 13, which is very alkaline. So anything which disturbs this normal pH of the scalp and hair is not good for hair. That is the reason we ask the patients to apply conditioner every time they wash their hair, because the shampoo is taking your hair towards alkaline 10 to 13, but it has to get back to acidic pH because the alkaline pH disturbs the hair cuticles, it opens up the hair cuticles and makes your hair rough. That is the reason conditioner should essentially be applied after every wash. And hair styling procedures like straightening, ironing, curling, these are all something which will disturb the scalp pH balance. So try to avoid it as much as you can. The next cause being simple dandruff. So now we understood the oiliness of scalp is because of the pilosebaceous secretions. If this secretion is more than normal, then the scalp is called as oily scalp. If it is less than normal, it is called as dry scalp. If it is normal, producing not excess, not too less, then it is a normal scalp. So people who are having oily scalp have a lot of predisposition to develop dandruff. So what is this dandruff? Dandruff is basically a fungal infection. It's a fungal colonization called as malassezia, which feeds on the oil component of the sebum. So more is the oil production, more is the dandruff tendency. And that is the reason we ask patients who are suffering from dandruff not to apply hair oils, because if you apply hair oil externally, that acts as food to the fungus and further the dandruff worsens. So if you're oily scalp and if you're suffering from dandruff issue, please get it treated. If not, the microinflammation present on the scalp can also be one of the reasons for hair fall. But the good thing with this kind of dandruff is once you treat the dandruff, the hair fall will be controlled. So try to maintain the hygiene of the scalp always. So until now, all these types of hair loss is categorized as non-scarring alopecias. In the sense, these hair, whichever is lost, with appropriate treatment can retain back. But there is one more type of hair fall called as scarring alopecias. So here, because of some specific skin diseases, that is hair diseases, the capacity of the hair follicle to produce new hair is completely lost because of destruction of the hair follicle. So for example, conditions like lichen planopilaris or tinea capitis, pseudopelade Brock. This is the final stage of scarred scalp, where the scalp is very much smooth and shiny, the hair follicles are completely destroyed. So whatever the treatment you give, the medical treatment, serums, oral supplementations will not help to regain the hair. But yes, you have to exactly identify what is the cause of the destruction of the hair follicles and treat it accordingly so that the disease severity is under control and you can stop at least where you are. So what should be done in such cases? So hair transplantation is something which definitely helps these kind of scarred alopecias to develop new hair. And next being, what is the role of unhealthy diet and bad lifestyle? So as we have seen, improper diet that is balanced. So as we have seen, if diet is not balanced and if you take junk food for a long duration or you don't consume a lot of fruits and vegetables in your diet on a daily basis, over a period of time, there is a chance that you will land into nutrition deficiencies and finally chronic telogen effluvium. So eating right, a balanced diet which is rich in protein, healthy calories, iron, essential fatty acids. So these kind of lots of fruits and vegetables, and also your lifestyle, your amount of sleep, good sleep you get, and late night wakefulness, and you're not having basic exercises in a day. All these things will definitely have a effect on your hair because of the increased oxidative stress in the body. So last but not the least, role of hard water in hair fall. So by now we understood the concept of scalp pH balance. So the pH of bore water is around 8, that is towards alkaline. But whereas pH of surface water is little acidic, around 6, 6.5. So usage of hard water to wash your hair might disturb the scalp pH balance and once again triggering the hair fall. So try to use soft water to wash your hair. So that's about various causes of hair fall. Now let us go into the management part of hair fall. So how do you manage this hair loss? So by now you got an idea about various causes of hair loss. So if you are suffering from any one of these, first try to do some diet modifications, eat healthy, stay healthy, do some exercise, and keep your lifestyle in a very healthy manner. Even after doing this, your hair fall, if it is not controlled, then try using some hair serums. So how to choose the right hair serum, we'll discuss subsequently. So even after using hair serum for a couple of months, your problem is not solved, then it is time to consult a dermatologist. Probably you are suffering from one of the causes enlisted. So it is time to get investigated and exactly identify the cause of the hair loss and go for appropriate treatment. So as a part of oral medications, depending upon the cause, we give various supplementations. For example, finasteride is an FDA approved drug which we usually prescribe for pattern baldness, and minoxidil is one excellent FDA approved ingredient which definitely gives us good hair growth. But there are few points that you have to remember before starting on minoxidil. It has to be started only through a dermatology prescription, and few points before starting minoxidil that it can give you paradoxical hair fall. That is, initial few weeks of starting minoxidil, there may be increase in the hair fall, and some people suffer from scaly scalp, and also rebound hair fall is something which it is bothersome because once you stop using minoxidil, then the grown out hair will again fall off. One more side effect, it can cause allergies and irritant contact dermatitis, and also unwanted hair grows in areas that is not expected on usage of minoxidil. So these are few side effects which you have to keep in mind before starting minoxidil. And other non-minoxidil serums are widely available in the market, and there are many good ingredients, out of which my favorite are Redensil, Procapil, Anagain, Capexil, Bicapil, caffeine, etc. So all these actives are non-minoxidil and act on different levels of the hair follicle to stimulate the new hair growth by increasing the anagen and decreasing the telogen phase. Coming to oral supplementation, in addition to finasteride in androgenic alopecias, other components like calcium and your vitamin D, vitamin B12, micronutrients like selenium, magnesium, iron, all these are also a component of your oral supplementation depending upon the cause of the hair fall and its severity. So in addition to oral and topical serums, there are a lot of procedural treatments available in dermatology clinics. Say for example, most widely used treatment for hair fall is platelet-rich plasma, either in the form of injections or derma rollers or derma pen. So now let us talk about my favorite serum for hair fall, that is Thrivco's hair serum. So before all, what is a serum and why should we use it, and what is that we have to expect from a serum, how to choose a good serum? This is going to be explained in detail now. As I told earlier, hair serum is something which we are going to start as an initial therapy before starting on oral therapies, because this is a direct medicine which reaches the hair follicles to stimulate the new hair growth. Choosing a right serum is very crucial nowadays amongst so many products available in the market. Not all costly products are efficient, remember. A good serum should have an efficient actives as well as an efficient base or the vehicle which carries these actives to the target. So here are the points why should you choose Thriveco hair serum as your first line therapy for hair fall. Number 1. It has 3 important award-winning actives which acts in synergy. Number 1 is Redensil, Anagen and Procapil. So these 3 actives act at various levels of the hair growth cycle so that almost all the causes of hair fall are targeted. Let us go into details about each molecule. Coming to Redensil. Redensil is a botanical extract. It's a plant derivative which has 3 important components. One is dihydrofuristin glucoside. So this is a sugar derivative which acts on the stem cells of the hair follicles. So once the stem cells are activated, there is new growth of the hair follicle. So the stem cells migrate from the outer root sheath, the stem cells present on the outer root sheath hair bulge area. If you remember in the hair anatomy, they migrate down towards the base of the hair follicle to produce a new hair. And the second component being epigallocatinin glucoside. So this is basically a anti-inflammatory which inhibits the interleukin 8, which is important for the microinflammation on the scalp, thereby decreasing the inflammation of the scalp and allowing the penetration of the other actives. And the third component is zinc and glycine. These are the important structural components of keratin, that is the important protein of the hair. So altogether, new anagen hair production is stimulated by Redensil. Now coming to Anagen. Anagen is once again a phytonutrient. It is derived from sprouted peas. So it is full of phytonutrients. So these nutrients reach the base of the hair follicle deep inside, where the dermal cells are enclosed by hair matrix cells. This is a very crucial structure of the hair bulb. So these phytonutrients go and stimulate the dermal papilla cells to produce specific signaling molecules called as fibroblast growth factor 7 and nogin. So these signaling molecules stimulate the hair matrix cells to produce new hair. So more and more follicles going into anagen phase. So thereby more and more new hair. And the third one is Procapil. This is once again a superhit molecule in pharma industry where there is significant hair growth and also decrease in the hair fall after usage of Procapil. So it has 3 components once again: epigenin, olinolic acid and biotinyl tripeptide. Epigenin increases the blood circulation to the hair follicles and thereby prolonging the anagen phase. Olinolic acid, it acts on the DHT by inhibiting the enzyme 5-alpha reductase and thereby targeting the hormonal hair loss. And third one being biotinyl tripeptide. These stimulates the follicular keratinocytes and also strengthens the anchoring filaments holding the anagen hair follicle tightly inside. So thereby prevents the hair fall. So altogether, normal kind of telogen effluvium as well as hormonal hair fall is targeted by this ingredient Procapil. And the beauty is these 3 ingredients are present in good percentage. Redensil around 3%, Anagen around 2% and Procapil around 1%. Second point why should we choose Thriveco hair serum is it has a very good hydrating, non-alcoholic and deep penetrating base or vehicle which carries these actives deep inside. As we discussed earlier, any hair serum should be alcohol free because alcohol causes flakiness on the scalp, thereby causing inflammation on the scalp and decreasing the penetration of other actives. So that problem is not there with this serum, wherein the deep penetrating base, which is made up of important molecules like low molecular weight hyaluronic acid, which is 33 kilodalton, that is very low molecular weight. And second one is pentavatin. So pentavitamin is also an excellent hydrating molecule which increases the NMF, that is natural moisturizing factor of the scalp, and thereby making it ready to absorb the actives and also for deep penetration of the actives. One more super ingredient is Hemimillis Virginia water. So this is the actual replacement of alcohol, and it also has an astringent property and dissolving and penetrating the actives deep inside. Other important ingredients like glycerin, niacinamide, D-panthenol also add to the increased blood circulation, increase in moisture, and thereby deep penetration of actives. So all the side effects seen with minoxidil usage, like your rebound hair fall, scaly scalp, irritation, itching, and unwanted hair, contact dermatitis, all these kind of side effects are not seen with the Trico hair serum. So in a way, it is definitely better than minoxidil, depending upon the severity of the hair fall. And also it is silicone free, silicone like feel it has, and the pH is very much near to the scalp pH, so that it maintains the scalp pH balance. It is suitable to all skin types, and most importantly, it is very easy to apply because it has a dropper. You can directly use a dropper to apply in the linear thread-like manner and giving it a good massage. So anyone having significant hair fall, which is more than 50 to 100 hair per day, you can definitely start using Thrideco hair serum. Use it for at least 3 to 4 months to see good results. Even after that, if you are not happy with the results, or if you feel that you're missing something, please consult your dermatologist to identify if there is any specific cause for hair fall and get it treated by an expert.